Good afternoon and welcome to the Danna-Gracey webinar today titled Cybersecurity in Healthcare, Is Your Medical Practice Prepared for a Breach? I'd like to introduce our presenters today, Tom Murphy and Julie Danna. Tom is a key producer specializing in workers' compensation as well as medical malpractice insurance. In addition, Tom performs malpractice claim studies for medical specialty societies and maintains an advisory position for various societies involving malpractice claims and tort reform. A founding partner of Danna-Gracey, Julie has always been a strong advocate for medical liability tort reform in Florida. Bringing over 17 years of experience and knowledge of Florida's medical malpractice, Julie is a specialist in cyber insurance. I'd like to now turn the reins over to Tom and Julie.
Good afternoon, everyone, and thank you for taking time out of your busy day to join us for what we hope is going to be a brief but very informative session on cyber threats and cybersecurity. And we wanted to thank you for being a part of that. And I'm here with Julie Danna. Julie, do you want to say hello?
Hi, I'm Julie Danna. Thanks for joining us today.
Great. Let's get started. And let's go ahead and forward the screen there, if you will, Stephanie. Today's challenge, as we all know in the medical world and with medical practices, that cyber threats are becoming a really big deal. We're starting to see more and more activity in this area. I know everybody sees all of the big cyber breaches on the news when you hear about the Targets and the Athenas and all of the other large companies, but this can affect everyone down to small practice. So it's really important, and we're glad you're all joining us today. But as part of this challenge, medical practices are the most sought after form of cyber breaches for these cyber criminals. And the reason for that is really simple, and Julie's going to expand on that a little bit more in a minute. But medical practices, for obvious reasons, have more information, not only financial information on individuals, but also their health records. And so these records can fetch really big money out on this black market, or what they call the dark market, anywhere from $50 to $300 per record. And so as you can see, that's why these cyber criminals are going after these records on a record basis. So every study we've seen is showing that medical practices and anybody in the medical world are going to have to be on guard for this, because it's the #1 type of data record that these criminals are looking for, and that includes banking, which is pretty amazing. So let's go ahead and move the slide, Steph, and I'm going to turn it over to Julie here to talk about coverage.
A lot of people say, well, what is a breach, and why do I need to worry about this? And one of the biggest things that people think is only electronic, but actually information is on paper format, and a disgruntled employee could actually take that information from your organization. And what the criminals are looking for are individuals' names. They can duplicate that. They can get social security numbers and get credit card information from there and create credit cards, driver's license information. Medical records, like Tom said, is one of the key components on the black market right now, and what they're going after, because there's so much information on a medical record, whether it's pharmaceutical information, patient information, birth date information, and a medical record is non-erasable, so that's why they get the most money. It also contains financial information and, of course, meaning credit card and debit. Remember, it's paper and electronic. Stephanie, can you change the slide again? The reason that this can be so expensive when they target your organization, and what I always say is that the criminals work 24/7. They have computers that keep on running day in and day out, trying to find opportunities to make money off of cyber. And the reason it's so expensive, if you have a breach and you have to notify the regulatory officials within the first 30 days in Florida, customer notification could be $1 to $2 per patient and employee if they get into your records and they get employee information. You have to send out letters. If you have anywhere from 3,000 to 20,000 patients, you have to send a letter out to every single one of them notifying that you've had a breach. Then you have to hire forensic research and data recovery to go back in. They are very expensive, $250 to $300 per hour to go in and then research what information's been taken and how to recover that information. Then you got to hire a lawyer, and be $400 to $600 per hour. Credit monitoring subscriptions is expensive as well, $10 to $20 per person in your practice, employees and customers, clients, patients. Credit card reissuance fee is $20 to $30 per credit card that has been compromised. And if you have a breach in your practice, you actually have to set up a hotline so that people who have had a breach can contact you. A lot of practices that are small cannot afford to do that. So when you add all this up on average, the average, according to Ponyman Institute, is about $201 per customer per breach.
And that cost is going up every day.
Yeah. Can you go to the next? I have a personal experience with a laptop being stolen, but this is an example of a doctor who had 11,000 patient information on his laptop and was stolen. And if you take that $201 and multiply it out, it gets very expensive. I was at a movie theater once and had a backpack in my car with a laptop in it. It was in the back seat. It was covered. But there's a device that's out now that they can go by your car and find out if there's electrical laptops, GPS in your car, so they can steal it. So they went by my car, and I guess they broke in. They saw the device went off saying there's electronics in there. They stole the laptop, and it was actually my nephew's, who is an IT guy, and he had hundreds and thousands of clients' information on that laptop. He lost his job. It was huge. So one of the things, Stephanie, can you go to the next slide, please? One of the ways to protect yourself, of course, is with insurance. And a lot of us who have malpractice insurance, actually, the malpractice policy offers a cyber insurance. And they're all called something different depending on the carrier, and there are different limits. But it's only $50,000 in general. So if you take that $50,000 and you just have to notify 2,000 patients, right there your money's gone, and then you don't, it's not adequate. So we always say, look at your policy, make sure that you have enough cyber insurance to cover your practice, whether you're a small practice or a large practice, and then talk to an expert that specializes in cyber insurance to make sure that you're actually covered the way you should be. Then the next slide talks about what insurance covers. And anyone who collects money, stores data, or has any kind of privacy information in the cloud needs to make sure that they have the appropriate coverage for their office. If a claim is, you have a breach, then you're going to, like we just said, you're going to have coverage for your clients and your employees, as many as you have. You have to cover your regulatory procedures. The cost to notify affected individuals, as we just said, is very expensive. These are just actually notes talking about what we just talked about a second ago. You got to restore your data and your computer programs that are damaged. Business interruption is huge, and the expense that you would need to get yourself back up and running, right there could destroy a practice. So you really have to make sure that your coverage covers that as well. One of the fallacies is that people believe their business office package will cover this insurance, but it does not. So some of the policies will actually even include loss of money due to people hacking into your systems. And Tom?
Okay, thanks, Julie. Yeah, as Julie was saying, very important information. And one of the things I'll talk about briefly in a few minutes is, in addition to the steps that you can take, some of the things to look for or ask about when securing this coverage. So moving on, we've got the most prevalent types of computer, or what we've been calling cyber threats. that medical practices and all businesses are currently dealing with. You know, one of the main ones that people deal with is it's not just disgruntled employees, it's any employee at all that isn't properly trained that may be using your or storing your data on personal, whether it be laptops or even company laptops, cell phones, smartphones, et cetera. You know, that information can be breached very easily if it's not encrypted, and you know, as Julie just gave in her example, things get lost and sometimes get stolen, and that can be a big issue. So these are things that we always need to, you know, be abreast of and constantly stay on top of. And Julie will talk a little bit in a couple of minutes about employee training, which is tantamount to, you know, stopping a lot of these problems, you know, from the get-go. So the next thing that is probably familiar to everybody, malware and viruses. These are probably the most common used terms that you hear with cyber threats and breaches. And malware and viruses are basically sent from a third party into your system to steal data or damage your system. And unless you have a really good IT person or have a encryption set up, this can be very damaging and can ruin a business, can ruin a medical practice. So that's one of the, it's been one of the long-term threats and continues. The next one has been around a few years, but it's becoming more prevalent, and that's ransomware. Ransomware is where you have another third party that locks down, gets into your system and locks it down and basically holds it hostage. They then contact you and tell you that they have your system locked down and that they're going to keep it locked down unless you pay them. And so this is, you know, no more than, you know, keeping your stuff hostage. And the worst part is that even if you pay for it, you have no way of knowing if they've sold your data to somebody else. So a very difficult situation. You want to obviously try to stay away from that if possible, but that goes back to what we were saying in terms of having things in place so that that doesn't happen. We've already talked about lost or stolen hardware. Won't belabor that, but phishing is another term that most of you have probably heard. Similar to, you know, the malware and viruses, where it's basically other parties sending false information to you to get you to respond, whether it be, you know, and I'm sure all of you have seen this, where you get an email, it looks like it's from a client or from a friend or from one of your doctors, and their email basically has been compromised, and it's not from them. So it's something we always tell everybody is always be careful with emails that you're opening or anything that you receive on your computer, especially your work computer where records are. Be careful what you open. Always look at things very carefully before you open the actual email, and then, of course, any enclosure. That's where most of the problems arise. But try not to, you know, do that. Always check. What I'll do is if I get an email, it doesn't look like a normal email, I'll respond, and if there's no response back, you know it's not the correct email, or you can call the person and they'll say, you know, they'll tell you, hey, my email was stolen or compromised. But definitely look into that before you open these emails on your system. And then the final one that's becoming very prevalent right now is social engineering. Social engineering is and as you can imagine, these criminals get very creative. And one of the things that they're doing now is they'll find a mid-size or larger company, and sometimes even smaller companies. And what they do is they befriend the employees, an employee or multiple employees, to the point where they gain the employee's trust, and eventually they're gaining access into your system. So this is just another way, a new way that that these cyber criminals are getting into your system. So a lot to be cognizant of. And I'm going to turn it over to Julie for the next slide here so that she can go into some of the ways that you can protect your practice from these cyber crimes.
We're full of gloom and doom, but there are ways to protect yourself. And hire only qualified IT support. Check with your specialty society administrators section and your county medical society and make sure you find someone who is qualified for cyber but also in medicine. That makes a big difference because they'll understand. Install and update antivirus software. Find a reputable company and have them provide updates to your software. make sure you understand all the HIPAA requirements, provide employee training, create a culture that you can, and have everything in one spot so that you have all your information so your employees can go be trained. I have a response guide and a response plan and a cyber risk assessment plan that I can send to you if anyone wants me to send it to them, that can really help guide you through these processes. There's so much to it, and you want to make sure that you take care of your organization and when you have a breach. Encryption obviously is very important for protected data. I'd have the doctors and staff who take information home or in their car, use their cell phones, have everything encrypted, and it's the most important thing you can do to protect yourself because people can't get in. And a lot of people say, you know, I have a great IT guy, so my IT guy is going to protect me, but that's what Target and Blue Cross Blue Shield said too, and look what happened to them, and I'm sure they had everything encrypted. So it's really important to make sure you have that. Hire and perform internal risk assessment and security audits. Larger practice that have qualified IT department people have that, but small practices need to hire a company to perform assessments and audits. It's really important to spend money, to save your money, and secure adequate cyber insurance. If you have it on your malpractice policy, like I said, and it's $50,000, for about $1,000 more a year, you can actually raise it to $1 million and protect your organization. Even small people need to look at this. It's what they're saying in our insurance world is that cyber insurance is going to become so huge and so expensive, so you need to look at it now to establish relationships to protect you in the future. And I'll refer back to Tom.
Thanks, Julie. And one of the things that before we close out here that I want to tell everybody is, you know, a lot of the stuff that Julie and I are saying, it sounds scary, and it is. There's no way to get around it. We're not, the purpose of our discussion is not to come out and scare people, but the reality is that it is scary, and this is going on. It's happening every day. Most of the IT people and cybersecurity people that I know in this world will tell you that your system has probably already been breached at least one time. You most likely are not aware of it because nothing's been done to harm you yet, but cyber criminals are testing your system out and getting in there. And so it just makes it that much more important for us to all get involved in this and have these systems in place so that, you know, we can protect ourselves, you know, from this stuff, because it is coming. And in closing, basically, everyone knows that, you know, that medical practices maintain a lot of personal and professional data, and we know that it's preferred by the cyber criminals. So at this point, you know, we know that it's tough for smaller independent practices to deal with this because of the cost that are involved. However, there are IT people out there, reputable ones, that can come in and do, you know, a basic assessment. Some of them will even do it, you know, for free or at a very low cost, just to kind of let you know where you're at. And give you ideas, and then they can also give you, you know, recommendations on what you need to do to get up to speed. Obviously, as Julie said, encryption is the most important thing you can do, and especially for electronic equipment that, you know, goes out of the office, not just in the office, but anything that goes out of the office. One of the other things I wanted to say was that, you know, the Office of Civil Rights is now implementing, as of January 1st, phase 2 of their audit program for HIPAA compliance. So this is just another governmental agency regulation that everybody's going to see, in addition to all the stuff we're seeing with CMS and RAC audits and everything else. They're now going to be pushing hard on compliance for HIPAA to make sure that medical practices and other businesses are keeping their patients' information secure. So it's another thing that everybody has to be concerned with, is that it's not just from your business standpoint. You've got the regulatory agencies now looking at you as well. So keep that in mind. And as Julie was saying, the insurance that you can secure for this to get $1 million in coverage is pretty minimal at this point. That's going to change over the next couple of years as these claims get bigger. So that's pretty much all we have at this point, and we're ready for any questions if anybody has any questions here. So let's take a moment here, and Stephanie, let's see if anything comes up for questions.
I wanted to mention real quick when I forgot when I was talking about encryption. Passwords are very important too on your cell phones and your laptops. Make sure that you change them regularly, and they can't be cute like ABC123 because that, or your children's birthdays, because the cyber criminals can figure that out in about 12 minutes or 12 seconds because they're so good at this. So it's really important to come up with numbers and colons and all very creative ones, and you have to change it at least every 90 days is what they're saying. So I just wanted to add that piece in.
Yeah. And it looks like we've got a question here from Randall Garner. Randall, if this is correct, it says, does the $2.2 million cost of the breach in your example include fines from HHS for the breach? And the answer to that would be no, because the costs that Julie outlined in that example are just the costs associated with the breach itself. And anytime we give examples like this, we never include fines and penalties because they're always different. And I will tell you this, that there have been fines and penalties issued. There was a group recently in Georgia, a large medical practice, that had this happen. And there were, if I'm not mistaken, I believe the fines and penalties were close to $1 million. So hopefully that answers your question, but it is a very good question because fines and penalties are over and above these cost examples that we give. And as you can see, because of all of the components involved in these breaches with notification of patients, notifying all of the regulatory agencies, hiring lawyers, hiring consultants, all of the things that are affiliated with this, credit monitoring, these things are very expensive things, and especially with these large breaches, it's amazing how expensive, how quickly they can get out of control. So more important, like I said, it's more important to make sure that you have this additional coverage because the basic coverages on a physician policy don't protect you for fines and penalties. When you purchase a standalone policy or over and above what you have on your med-mal policy, those policies typically will cover fines and penalties, but you need to make sure as well. So let's see, another question here. Julie, you want to take the next question?
I don't see it, Tom, so.
Okay, I've got another one here. It says, what is considered sufficient coverage for a small two-physician practice? Julie kind of touched on this earlier, and at this point, small medical practices, to have a minimum of $1 million in coverage is where you want to be. And in addition to that, it's not just the limit of coverage. You want to discuss the actual coverages. When you're securing the coverage, make sure that when you're talking with your agent that they go over the coverages that are part of this package. We've discussed those coverages in this little seminar here, but it's really important because you want to make sure, for instance, that fines and penalties are covered. So that's, the second part of the equation is, you want that type of coverage. You want a minimum of $1 million limits. Some for larger, mid-sized to larger practices, you want to try to get more, and it's out there. And as I said earlier, right now it's very reasonable. I have 1- and 2-man practices that are paying, $1,200 to $1,500 a year for this coverage. So I highly recommend it. Julie, did you have any other questions, or did you see any others?
No, I didn't see any.
Okay. All right, so we wanted to thank everybody again for attending today, and hopefully we've enlightened you some and answered some of your questions, and would like to remind you that the webinar is going to be recorded, so it'll be available on our website at www.danna-gracey.com, and we can also email it to anybody that would like it. And if you certainly have any questions, you'll see on the screen there, you can reach us, either Julie in her office or me, call any one of us. And we wanted to thank you again for joining us today, and look forward to working with you.
Yeah, thank you.